I don't ever feel like we ever successfully save the mock patient, but going from there, you do take things away like, okay, well, in this situation, we would have done X, Y, and Z. It probably would have been more efficient. But then you remember that, oh, I kind of did this, I did that, or we were looking at this thought process or whatever. So, like how you said, like, I think it's the hands-on of teaching why you're going to do it and having the hands-on portion, because I feel like a lot of our newer nurses who move into a trauma bay do receive a lot of retention after they go through like a stat training.
Yeah, and understanding the why I think is a key point. I mean, the case I always use is the paramedics bring in a patient in AFib with RVR and they've given cardizem to slow the rate down. It's like, did you ask if that was actually needed? Like, why did you do it? Are you just responding to, this is AFib with RVR, we give cardizem every time? Or did you ask why they're in AFib with RVR? Is this their version of sinus tach because they're septic? We don't want to control their rate in a lot of these situations. And I think that's a good example of EMT thinking, or just task, oriented thinking. Like, we see AFib with RVR, we give this medication every time. Well, that's not really true. You have to think about the underlying cause. You have to think about the why. And so I think that's key to teaching some of these new folks.